We're seeing quite a renaissance in the UK of what's called social prescriptions rather than clinical prescriptions. So what that means is that if you're suffering of a mental health problem, depression, anxiety, loneliness, whatever, instead of being given a clinical prescription for medication, you're given a social prescription, which means you're sent off to like a walking group or an allotment or, dog walking society, or we have these things called men's sheds in the UK, which are just the most wonderful things. It's these different sheds that open up all over the country. They're set up by men, often for men, although women do often go to them too. And it's often older men who are lonely get together, go to these sheds, and they build and mend tools and toys for local families and children. So it's a
My
bunch of lonely
goodness.
men getting together, fixing toys for local kids. And it has such a profoundly positive impact on men's mental health because they are often very lonely. Just being in the same space as other men who are lonely really, really helps. They're getting that sense of purpose and belonging and camaraderie. They're building and fixing things for local families, which is obviously excellent. And it's lightening the burden on our already impoverished National Health Service by taking them away from hospitals and taking them out of the clinical environment and doing something that's actually of massive societal benefit. So yeah, hiking groups I've seen, cycling societies, so the breakfast clubs, like really, really, really exciting things like that. Football games and stuff like that. Like I'm really a big fan of social prescription, and it's in many ways it's an indictment of how much we have failed men's health because that's not been done by the National Health Service. It's been done by independent individuals who are sort of sick of being failed. And lots of women go too. Lots of women want to do it. So a lot of women want to go on like a hiking groups, and that's excellent too. It's not just about men, although it does seem to be more beneficial to men. But who am I to speak on what women do or don't need?
No, I think that makes total sense. I mean, being active, being around other people seems to be a huge benefit to mental health in general.
Mm.
And I mean, I'm in Canada. I don't know of anything like that here in Canada, and I think that would be
Lots of hiking routes to
huge.
Canada.
Yeah,
I went.
fair
I mean,
enough.
I went to a fundraiser for a charity, which I'll shout out, called Strong Men, and they support bereaved men, a lot of fathers who've lost children. I met
Okay.